Okay. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, and thank you very much for the organizing committee for Kerbala College of Medicine, its dean, Dr. Ali Abu Thin, for asking me to be part of this conference. I would like to talk about when Dr. Ali asked me to have a talk on a speech. I decided to talk about our experience during curriculum reform at Baghdad College of Medicine because I think there are lessons learned. I would like our followers to make use of these lessons in their future, if they are going to change their curricula or modernize it according to the standardized everywhere in the world. To start with, when I joined the medical school at Baghdad College of Medicine in 2005, my professor, Dr. Hikmat Sharbaf, gave me his lectures of ECG to be presented for the fourth-year student. I was very busy in preparing for these lectures. The advice from my colleague at the Department of Medicine, College of Medicine, University of Baghdad is that don't bother yourself. You will have very few students at the lecture theater. And those brilliant students will write down your lecture, and there is a shop outside, photocopy shop. They will photocopy your lecture and will be distributed among all other students. So don't bother yourself. You can give them the lecture and they will copy it to others. And that was the message. Few students will attend, write down your lecture, photocopies will be distributed later on. And then I was asking a big question, is that the real academic life that I was dreaming of before joining the medical school? Then I entered the first lecture with the ECG sessions to the fourth-year medical student, and it was there. Only 15 students out of 200 were attending the large group teaching or the lecture. But I decided to give as if the room is full, the hall is full. And after a series of 6 lectures, the lecture room was full. So from only few students attending the session to a full room attending the session. So the first thing come to my mind is that the main problem here is the performance of the teacher. So there must be some problems with the teacher preparation, the way of instructional methodology he is using to the students, and therefore the attendance rate is low. And probably because the large number of students have been recruited every year to the medical student, probably this is have an impact. And then a big question come to my mind. How are other medical schools outside Iraq doing their job? What's about the British medical schools, which usually the Iraqi medical schools follow? Then there was a chance for me in 2010 by a personal effort to visit that medical school, which is Sheffield Medical School. And I was welcomed by the dean of that medical school, Professor Nigel Bax. He's a very well-known figure in the world in medical education, and his wife also, Professor Deborah Bax. There are so many questions in my mind. What about the number of students they are recruiting every year? What is the type of curriculum they are using? And what is the ways or the methods of teaching and learning? And how do they assess their students? So many questions in my mind. And after that, I attended a session at Sheffield University College of Medicine, large group teaching. And for my surprise, that the lecture hall accommodating 400 students is more than my session of 200. And what is different in that large group teaching session? There are 2 professors presenting the session. One of them is physician and the other is pharmacologist, and they are addressing a Cushing disease. And during the session, they are using clickers, and these voting systems are used every few slides. They are doing quizzes for the attendee, that they keep the session interactive all the time. And also at the last 5 minutes of the session, they brought a patient with Cushing syndrome to the lecture hall, and they give him the chance to have a few minutes talk about how he developed the disease and what are the consequences of the Cushing syndrome in that patient. At that time, I realized that we should change the way of delivering our teaching sessions at least at my College of Medicine. After that, I met the professor. She's a lady from Sri Lanka. She is in charge of medical curriculum and medical education. And during discussion with her, there are a lot of things and new statements that I am not aware about, including competency-based, outcome-based curriculum integration, horizontal, vertical integration, personal and professional development, interactive teaching, passive versus active, deep learning versus superficial learning, kinds of assessment, including formative and summative. But at the end of the day, I realized I am nowhere. What are these terms? What is the meaning of these terms? That is in 2010. And you can realize I am here in the middle and hearing all these new terminology, which are totally different from the cardiology practice and qualification that I am in. So I realized there must be another aspect of faculty member. Beside his profession, there must be development in medical education because it is a science and it is a discipline as well. At that time, and by a personal effort, thanks God, we are able to have the Delphi Award from the British Council to modernize our curriculum in collaboration with Nottingham University. And this was signed in 2010. And we go together with 16 members of the faculty member from Baghdad College of Medicine to Nottingham. We spend 2 weeks with them, with their faculty member, having extensive presentations and sessions, a workshop about the new curriculum and the development of the new curriculum. And you can imagine, we are completely stunned and dizzy. What is going on? This is a new world we haven't been previously exposed to. And then I want to go, what is going outside? How do they change their curriculum? And is that an easy way? How can be achieved simply? And I found that worldwide, the medical institutions or academic institutions generally, they are resisting the change. And what is called, there is a behavioral apathy. Every institution try to be as it is. Don't change anything. مثل ما يقولون keep it on the safe side. Don't disturb the situation you are being in. And also there is something related to the stakeholders, because even if the proposed curriculum is supported by the majority of the stakeholders, there are many factors affecting how do the change have been received, how it is going to be implemented, and the most important point I want to highlight, how can this be maintained, which is very important for our situation, as we have more than 7 or 8 medical schools change their curriculum right now. It is very important as well for the change leaders to address and prepare before deciding to implement a curriculum. And that is whether the institution is ready to accept the change or not. This is very important to reach a success at the end of the day. And also, if the leader do not consider academic needs of the faculty members, of the other administrative staff, including the academic freedom, the autonomy, and a negative perception at the university, from the academic staff as well as from supportive staff, this may create a resistance to the change and makes life difficult to the change leader later on. And also the leader should have certain skills, and these leadership skills to have the change accurate, such as having a motivated personality, wide knowledge, good vision, experience, high level of communication. And because this means either there is an effective change leaders or they are ineffective. And then also I found that there are a few researchers like Verholtz and Lamberkast identify several human factors as barrier for bringing change in higher education, and can be grouped in three terms. The first one is that lack of awareness. People at the academic institution, probably like me 10 years ago or 12 years ago, I am not aware about all the things and the terminologies about the medical education, even the basics. So very important to have this awareness among people we are working. The second thing is that unsupported structure of the academic institution is very important, because the conservative disciplinary structure of higher education institute and inefficient communication, resistant to change, and the crowded curriculum, all of them makes hinder to the changes that we are seeking for. And the third area is the resources. And I mean by resources, not only the physical and financial, also the time and the human resources, which make the changes possible and successful story. I should focus here also on the application of a critical leadership skills, which is very necessary to do that change. It is vital to let people affected by the change to know the rationale and the process of change, why we are changing, how we are going to change, and how we are going to maintain the change. The change management literature shows that most effective factor for being successful in curriculum change is appropriate leadership. And this leadership should be stable, confident, flexible, and able to motivate others and to positively maintain the change curriculum. The other issue is that critical factors affecting strategic change process in education project, including resources, academic staff resistance, and how we are going to deal with it, and student enrollment in every aspect of this process is very critical and vital. Also, there are a number of issues for a change leader to address before deciding to implement the curriculum. And the key preparation change is that organizational structure. The academic institution have to change its organizations, including medical education unit, curriculum committee, assessment committee, quality assurance for assessment. This is very important. This organizational structure, very important to make the change applicable, successful, and we can maintain it. And also ensure that the learning environment in that academic institution is supportive, because we have to measure the cost of that change. And also at the end of the day, either we will have a good and effective change or it is not. This is a very important story. I came across a very interesting study coming from Sydney University. While they are going to reform their curriculum, they want to check whether they are ready for it or not. And therefore, they did a survey. That survey was conducted at the University of Sydney Medical School for identify the requirements of the change and the approach for that change, and to set goals and strategies. They did that survey among the academic as well as the clinical staff of that medical school. And that includes 5 items. The first one is that awareness for the need of the change. Are the staff aware that there is a need for a change or not? And the desire to participate and support the change among the staff. And if they are knowledgeable about how to change, and if they are able to implement the new skills and behavior, and then reinforcement to sustain the change. And the result of this survey, which is very important one, they found the main concern of the staff is that they are concerned about the resources, including financials and human resources, consultation and communication, challenges around that transition, because all you know, when we change a curriculum from a new old one to a new one, so there are 2 programs running at the same time. So what about this transitional zone? How we are going to update the new curriculum which is implemented, and how we are going to upskill the staff the faculty staff by providing the training and support. So, to be concluded from my presentation, what learned lessons or lesson learned from my experience, humble experience during leading the change of curriculum at Baghdad College of Medicine. We faced a lot of resistance from the staff, and we tried to come over by repeated training courses and discussions and dialogues and etc. with them to keep them. Some of the staff tried to be kept in the quiet zone, because you all know that modern medical education needs time and effort from the faculty member in every aspect: planning, implementing, monitoring, reflecting, etc. And the second thing is that we face that there are lack of interest of policymaker in doing the change, and that was a problem. Besides, there is a problem in legislations and regulation, what does not match the concepts of modern medical education. And for example, the pass mark of 50, still the pass mark should be 50. There is no application of the scientific assessment depend on ANGAF and other methods to have the pass mark. And at the end, we also found some resistance from the students, because it needs more time, more studying, more interaction, more reflection, etc. So I came across 7 points that I learned from this process. Lack of awareness about the basic principles of medical education among many academic institution leaders, faculty members, and policymakers. And this is very important. And our aim is that to widespread make awareness or campaign, national campaign for that. The second thing is that there is a greater chance of achieving success if the head of the academic institution is the leader of the curriculum reform. And we have examples in our dear colleagues in Kerbala as well as in Kufa medical schools. Great success will be there if the head of the dean is leading the change. Third thing is that curriculum reform should be seen as a whole process for the need of the change. The main stakeholder should be involved, assuring readiness of the academic institution and availability of skillful change leaders. This is a very important issue and card. There must be a skillful change leaders. The fourth thing is that increasing awareness about the main policymaker at the Ministry of Higher Education and University about the importance of the need of the change and adoption of it. All the change of curriculum in Iraq was led by personal initiative from certain faculty members, but it must be a national policy for that, adopted by higher policymakers. And then assuring availability of resources as much as we can, from the human, physical, and financial. Establishing, this is very important point, we need a national regulatory body concerned with spreading of the culture of modern medical education and supervision of academic institution. There is no such a body right now dealing with medical education and supervision of medical schools. And the last one is that legislation and regulation modification, because there are many issues related to the regulation and legislations. At the end, I thank you for your listening, and thank you again for the organizing committee and College of Medicine of Kerbala.
And I have one comment for Hilal's talk. Hilal, you're always a master blaster, so wonderful. So you learn so much from one talk. Now, I have a question. How would you integrate various types of curricula in a system where we are still struggling, like I'm talking about Iraq, for example, we're still struggling to initiate a proper process of medical education. I've been coming here for several years. We're still in the early stages. My fear is that we're only talking and talking and talking. I don't see any practical illustration. Two examples that you quoted, and that's true. Sayyid Abdul Zahra started a long time ago in Kerbala, and of course now Radha Imran is doing it, and of course Kerbala, Deen Zubaydi, I'm sorry, and Kufa Sayyid But are we expanding these services across Iraq or not? And you're the best person to do it, because we have to think of accreditation process. Gaurav is going to talk about it. So maybe you can dilate upon it. What is the situation in Iraqi medical colleges right across the board? Thank you.
Thank you, Professor Shabih. Yes, that the issue I want to highlight is that all the changes in the medical schools now that happening for in 8 or I don't know 10 medical schools that change their curriculum is by personal initiative of certain faculty members or deans who are enthusiastic and who have been the chance to be exposed to outside and have seen what is going outside Iraq, but it is not in a systematic way. It doesn't involve all medical schools, which number of medical schools now more than 30 medical schools. Therefore, we should say it loudly. At the present time, we need a body, and that body, I think, in the UK, the GMC is having a regulatory role over all medical schools. While I was in Sheffield, they were in a stress and they were working day and night because there is a team from the GMC is coming to the Sheffield Medical School to review all the curriculum and to see what is going on and to be assure the quality of that learning process. We are lacking in Iraq such a body. This is a call, and this is a big say yes for a body in Iraq looking after medical education, the types of curriculum, modernization of teaching methods, of syllabus, as well as assessment. This is very important. We have been talking to some officials, but as I figure out in my slides, there is a general, um, let's say it in a more polite way, there is very humble knowledge about basics of medical education, about policymaker. And this issue is very critical for our situation in Iraq. Thank you.
Now, I'd like to interact there. See, this is the situation, this is the position, because I deeply feel for what's happening, and I've been coming for years. Like, I think what is lacking, my dear friend, is that you have to start your own courses of medical education. Hiring other people to come and getting advice from it, it's not practical. You have to have your own program, develop the programs. I'm not advising or guiding, I'm just suggesting. I'm not in a position to advise or guide. The senior people like Gohar Baji sitting here, Naveed Yusuf and Muhammad Tariq and Tabassum, great educators, they will tell us more. But what I feel is that you have to get your younger faculty involved in achieving certain qualification. Let it be certification, medical education, let it be a diploma or master's program or a PhD program. And the reason I pointed out this is that I was talking to Radha Moran earlier on. We can think of developing a joint program with Sadiq International Virtual University because we have international talent pool. Starting with certification, you can go on to this. Please think about it, and you're the right person to guide these people right across Iraq. Thank you so much.
Totally agree,
Thank you.
Professor. At least, sorry, Ali, just one thing. We were attaching Nottingham University 10 years ago for that reason, but the problem of passing the IELTS and other English requirements, etc., make things difficult. But your point is very well received. We have to have a degree in medical education across Iraq.
Thank you, Dr. Hilal. We have a question from Dr. Nazar Haddad from University of Basra College of Medicine. He is a pathologist. And Dr. Nazar, will you ask your question, please?
Thank you very much, Dr. Ali, and thank you for the nice presentation we heard till now. My questions to Dr. Hilal. Still, there is a chance of curriculum reform in our colleges with this huge student intake and ballooning in student intake?
May I answer, Ali? Okay.
Yes, please. Yes, please. Go on, Dr.
مرحبا نزار، شلونك؟ Yes, I think yes. Our way of thinking always putting the challenges before the goal. We have a big goal, and there are many challenges. Our previous thinking, myself was one of them, putting the challenges before the goal. I think we have to give the goal first and then try to deal with challenges. Nazar, you know, even if we have the old traditional curriculum, but there are a few concepts related to assessment, formative assessment, passing mark, teaching methodology, interactive teaching, deep learning, reflective practice. All these things are not related to the changing the whole curriculum. They are part of whatever the type of curriculum we are doing. Therefore, I think we can do something. We can improve our abilities. Probably 10%, 20%, 30%, and also probably this is the answer for the other question, how we are going to deal with the very large number of students. The main problem here comes from the clinical training. And by clinical training, I think brilliant leaders, and I figure it out. We need skillful leaders, change leaders, because we may have the hours of a training doubled rather than only from 8 o'clock to 2 o'clock. Probably you have another shift at afternoon shift for training. I don't know, but definitely there is some way to minimize the effect of bad things and to deal with challenges. Thank you.